Our next speaker is Sir David Behan, who is currently the Chair of Health Education England, and very grateful that Sir David's been able to find time to come to talk to us. David began career as a qualified social worker and rose to be Director of Social Service in 3 local authorities, as well as being President of the Association of Directors of Social Services. From there, he became the first Chief Inspector of the Commission for Social Care Inspection, and in 2006 appointed to the Department of Health as Director General for Social Care, Local Government and Care Partnerships. In 2012, Sir David moved to be the Chief Executive of the Care Quality Commission. And in December 2018, appointed as Chair of Health Education England. I should also mention that in 2017, he was knighted for all of the work that I've just described to you. So I'd like to introduce Sir David and look forward to your talk. Thank you very much.
Well, thanks for that. You must remind me never to follow Trudy in a presentation, because we're going to end up tripping over each other. But it's been a real treat for me to come here. I know you're launching the partnership and the work that you've been doing, and I want to just pay tribute to the work that I've watched, particularly through the last 3 roles that have been described to you. I've watched the way that partnerships are developed in Leeds and the way you've been able to build on that. And one of the privileges of having a national role is you do get to see what's happening in other parts of the country. So when you see something that is doing really well and accelerating and adding value, it's pretty clear in some of the roles that I've had where that is, because it contrasts with other places where the quality of those relationships aren't quite the same, and therefore what you've been able to develop and deliver stands in contrast to those areas. I also just want to reflect on the time. I will have spent about 24 hours in Leeds by the time I leave later this evening, just a bit short. And I joined some colleagues at the university for dinner yesterday evening to have a conversation about 21st century care. And I've just spent a really, just genuinely really interesting morning in the university, learning about how technology is informing those of you that are being taught in the university, some of the things you're being taught and some of the tools and techniques that are available. And I was reflecting back to colleagues that since I took the HEE job in December 2018, I've been going around trusts and I've been going around a good number of universities. And when I go to the universities, I always ask the question around how they're thinking about 21st century care and what does that mean for the education and training of undergraduates, not just medical undergraduates, but all undergraduates. And in a sense, I get, very interesting, it's very exciting, and I get a lot of very warm words. I have to say that the time I've spent with colleagues here this morning is the first time I've got a real sense of what the practical application of some of that science and technology actually means, both for the tools that are being offered to you as medical students, but also some of the technologies that will be available to you when you go into practice. And again, I want to pay a particular tribute to that. Which is a really nice lead in to what you've asked me to talk about, which is delivering 21st century care. And one of the advantages of having the background that I have is I've been around health and care at a national level for quite a long time. But I've not had, until I took this job, much experience and exposure to the issues around education and training. So one of the advantages is I can just wander around asking innocent questions and actually beginning to listen to the answers. And in doing that, as I say, I've been trying to understand better the relationship between the future and how science and technology is going to change the future and what that means for the education of professionals over this next period. So let me just open that debate up a little bit and just share some thoughts with you that I hope complement what Trudy's just taken us through. There's about 160,000 students that HEE are currently supporting, in inverted commas, to some degree, currently in education across all professions. There's something like 340 different roles in the English National Health Service alone. So 340 different ways of describing jobs that come through the education and training system. And as Trudy has already set out, I just want to pull out how I think that number is going to increase as more and more people from engineering and science backgrounds are actually going to enter the workforce and absolutely be a key component of that workforce. So I think that number of roles is going to increase, but paradoxically, that's all going to happen at a time. I think the World Health Organization had their Education and Training Summit, I think it was last week. And again, they repeated this statistic, which I find really concentrates my thinking, which is by 2030, the World Health Organization are projecting a shortage of healthcare professionals of 18 million. So what that means in my mind is that if medical professionals and medical students are a global commodity, I think you are, then that needs to be set within that global context. So when we talk about the future workforce, one of the issues we need to be really clear about is if there is a global shortage, what is it that we're going to do to actually reflect on where our future workforce in this country is going to come from? And where that takes me is carrying on as we always have done is not going to get us to the place that we need to be. So we do need more, but we also need to think differently and creatively about where that future workforce is going to come from, and think different and creatively about how we're going to train and educate that future workforce. So along with Trudy's slide about the fourth industrial revolution, I also think we're looking at a fourth revolution in education as well. It's not just the industry and the services that are changing. I think the way that we are educated is going to change as well. And I just want to go back to look at 40 years back, 1980. It was before Ernie Wise made he was a comedian for those of you of a certain age, who made the first mobile telephone call. It was 10 years before Tim Berners-Lee invented the internet. And apps are what you filled in when you wanted to make an application for a job. So it was a completely different world. And for those of us that have been around and our working lives have been spent through that period, I want you to take that 40 years and just reflect on what has happened in that 40 years. Do it in 20 if you can't go back 40 years. But then I want you to project to the future about what are the changes that will take place over the next 40, that next 20 years. And I think the speed of change is going to increase. It's not going to take place at the same rate. Then hold that in your mind, because of people in this room, 50% of you are going to be working in, if let's say 100% are employed by the NHS, 50% of you are going to be working in the NHS in 20 years' time. So what are you going to be doing? And if technology is going to advance at the rate that it has done over the past 20 years, how is that going to influence and inform what you're going to be doing? And as I said to colleagues from the university, that change is going to take place not just in the way that tools are available to those of you that are practicing in healthcare settings. Those tools are going to change in the way that you're educated and trained as well. So we actually need to see a future where the change in the future is going to be as profound as it has been over this past 40 years. We haven't got time. I could digress in all kind of things about when I did my statistics course in 1974 as an undergraduate. The computer was about as big as this room. literally, and just how that technology has advanced.